Carbon monoxide. Carbon monoxide is a colorless, odorless, and tasteless gas. In low concentrations, CO participates in normal human metabolism. In high doses, CO causes serious poisoning. CO arising from organic matter combustion under limited oxygen availability is the most important from the toxicological point of view. Lack of oxygen prevents complete oxidation to carbon dioxide. Carbon-based fuels are the main source. High amounts of CO can be formed during house fires or explosions in coal mines. CO is also generated during tobacco smoking. CO intoxication is usually accidental. Exposure typically occurs in enclosed or semi-enclosed areas. CO is initially non-irritating and its detection is extremely difficult. CO poisoning is very insidious. CO enters the body in inhaled air and passes to the blood during the gas exchange in the lungs. The precise mechanism of its toxicity is not completely known. It includes CO binding to hemoglobin, myoglobin, and mitochondrial cytochrome oxidase, leading to hypoxia and to brain lipid pre-oxidation. The bond of CO to hemoglobin is perhaps the best described mechanism of CO toxicity. Hemoglobin, with the 4 binding sites, transfers oxygen in the blood and enables its supply to the tissues. The affinity of CO to hemoglobin is 230 times higher than that of oxygen. CO easily binds to and blocks one binding site for oxygen. Carboxyhemoglobin is formed. Hypoxia is quickly induced and may lead to tissue injury. Hypoxia affects all tissues, namely the tissues that are highly dependent on the oxygen supply, such as the heart and the brain. Anemic patients are naturally more sensitive. A mild acute CO poisoning leads to nausea, headache, vertigo, and weakness. Can be mistaken for flu or food poisoning. If the exposure continues, the following symptoms will develop: tachycardia or another dysrhythmia and hypotension, hallucinations and confusion, abnormal respiration pattern. It oscillates between apnea and hyperpnea. In severe poisoning, these problems progress to seizures, central nervous system depression, unconsciousness, respiratory arrest, and death. A bright red color of the cadaver that appears lifelike. If the patient survives, delayed neurological problems will follow in up to a half of cases. For example, irritability, depressed mood, confusion, and short-term memory loss. CO is very dangerous during pregnancy because there is a higher affinity to fetal hemoglobin than to normal hemoglobin. It leads to accumulation in the fetal tissue. This is why smoking during pregnancy has a negative impact on fetal CNS development. Treatment is based on 100% oxygen supply or hyperbaric oxygen therapy. Oxygen abundance speeds up the removal of CO from carboxyhemoglobin. Unconsciousness may persist for several days despite the reduced blood levels of carboxyhemoglobin.